Hi, my name is Anne, and I'm the host of Taking Questions. And today I am speaking with Dr. Lyndsey Harper, who is the founder and CEO of Rosy, an award-winning health app that offers women personalized solutions for sexual wellness. Welcome, Dr. Harper.
Thank you so much. I'm so glad to be here with you, Anne. I appreciate the opportunity and really excited for our discussion.
Well, tell me a little bit about your background and how you got interested in sexual wellness, and tell us a little bit about Rosy.
Certainly. Yeah. I live in Texas. I am an OBGYN here in Dallas. I always knew growing up that I wanted to be a physician. And then when I was in medical school, really discovered my love of women's health, particularly. I think some things I love about women's health are that I get to hang out with women like you and me all day long and chat about the things that, just like we were chatting before we started, that are fun and interesting and also really important in our lives. And also I love surgery. So that was a big component of it for me. The miracle of birth and also I don't know, I think there are lots of opportunities when you're taking care of women to really connect about things that we don't normally connect about in everyday conversations, like pregnancy loss or infertility, or, if there's trouble in a relationship or sexual dysfunction, sexual problems. And so I really have always valued the opportunity to kind of be in those tough spaces with other women because I think there's such a high value that offers me to be able to be there for somebody else in those tough moments. And so I think that probably because I love that specific aspect of it, became my story in terms of women's sexual health because what I was seeing is that in my practice, I had been well trained when it came to pregnancy and surgery and, contraception and STIs. But a concern that my patients were sharing with me really regularly, multiple times a day, were things like, I love my partner, but I don't care if we ever have sex again, like literally. Or I am having really painful sex, or my orgasm is just not what it used to be. And I was like, man, like the trust that my patients are giving me by sharing these things with me is enormous, right? Because they often haven't ever talked to anyone, including their partner, about these
Mhm.
things. But the problem was is that I hadn't had any training. And so I was meeting that huge level of trust and disclosure with like I don't really know what to do to help. And that doesn't feel very good as a physician or, just generally speaking when someone's coming to you for counsel if you're like, I don't know. And so I got really interested in the topic because I was really surprised at how many patients needed help, but how little training I had, even as a women's health expert, right? And so I went and asked around and joined a medical society called ISWISH for all they do sexual health. And there's a lot of things we can recommend to our patients besides drinking a glass of wine or finding a new partner that really do help. It's just that we as physicians, as a medical community, as a society are missing that education and missing those conversations. And then therefore women are suffering in silence and embarrassment and shame, and that's unnecessary. So I really became the only word to use here that works is obsessed with the
Yeah.
topic when I learned that 43% of women are having a sexual problem, but they really are having a hard time getting to the resources they need to help. And that's really what Rosy is all about. Rosy is a digital health platform that anybody can download on their phone for free and have access to what we call the sexual wellness score, which really onboards women in a way that we think is super important. So we take into account the medical side of things, the mental health side of things, the relationship side of things, even the religious side of things. And we create a personalized program specific to you and the type of sexual challenge that you're facing. We really welcome all of our members with a lot of openness. The idea is to erase shame and isolation around these really personal but common
Mhm.
issues so that we can have conversations just like this and we can spread the word about how important this is and how common it is and help women across the world.
That's great. And we at Women S, we're trying to break the taboo around sexual wellness and around the topic of menopause. And we know that with sexual health, there's not a one size fits all solution. But tell me, what are the biggest complaints that you hear about when women come to Rosie?
Yeah, so the number one sexual health complaint that women have is low sexual desire. That's experienced by about 38% of women. There's a large study called the Preside study, and that's where I'm getting all of this data. So it's the number one most common. The second most common is trouble with arousal and orgasm. So, especially around the time of menopause, women will say, oh, it's just not what it used to be, or I'm just having a harder time getting the engine going, or maybe you're still having orgasms, but they're not as, as life changing as we might have once experienced. So that those are really common complaints. And then another thing that I think is pertinent to menopause and actually across the lifespan is sexual pain. Sexual pain has many different causes, but during menopause, the primary cause usually is vaginal dryness. And sexual pain is experienced by about 75% of women at some point in their lives, and significant vaginal dryness by about half of women during and after menopause. So, really, really common complaints that women just kind of like, I think it's the same with so many things with menopause, with leaking urine, with sexual
Hmm.
problems. We're kind of like, well, this is part of it, like this is
Right.
the woman's plight. And meanwhile, we're kind of suffering in silence. We kind of make jokes about it with our friends. But what we don't realize is that we all deserve to feel better. We all deserve treatment, and those treatment options are available.
And what is the number one treatment option that you would recommend to somebody who was suffering from vaginal dryness?
Yeah, it's from vaginal dryness, the way that we usually talk about it from a physician's perspective is, hey, let's take a look, right? We always want to make sure to take a look and see what's going on. But if you're experiencing vaginal dryness and that started around the time of menopause, then we can
Hmm.
infer using what we know about menopause that the estrogen levels went down, the testosterone levels have gone down, and because of that, the vaginal tissue gets thinner, it doesn't make as much of its own moisture, and it also is more prone to easily tearing. And so, always, and even for people who are not menopausal, I always recommend lubrication because it increases sexual pleasure, even in the absence of pain. Lubrication is never a bad idea. You just want to make sure that you understand the components of the lube, and that way you can make sure to use it appropriately in the right situations. And then, if lubrication doesn't cut it, vaginal estrogen or a vaginal DHEA is a really great option as well. So something definitely to be in contact with your, women's health provider about, because nobody ever needs to suffer with vaginal dryness and resulting sexual pain, because there's lots and lots of options for that.
Hmm. You brought up the lubrication. Is that something that can be used internally and externally? I get that question a
Sure.
lot at the after party.
Yeah, absolutely. So lubrication can be used internally, so in the vagina. It can be used externally on the vulva. So the vulva is everything you can see on the outside. I have a vulva puppet. If I don't know where it is. I should have grabbed it for this. Oh, right here. Look at this. Okay, so this is the vulva upside down. So the vulva is everything you can see external. So this is that retraction foreskin of the penis to reveal the clitoral head. These are the labia minora and these are the labia majora. Inside is the vagina. So everything that we see on the outside is called the vulva. The inside, where tampons go and speculum go at the doctor's office, and penis, if you're having penetrative sex, that's the vagina. So lubrication can go inside the vagina and it can go external on the vulva. And a lot of times it's helpful on the clitoris for clitoral stimulation so that it doesn't provide too much friction. And also, if there's any, anal play going on, it can be used internally there as well.
Great. One of the questions I had for you, a woman had asked, can intercourse cause her to restart being in menopause? Can it cause her to bleed? And I think that the bleeding probably comes from the drier vaginal walls, not actually restarting menopause. But if you could address that.
Yeah, I think you've really nailed it there. It depends on the source of the right. So whenever we're sexually active, there can be bleeding from the vagina. There can also sometimes be bleeding from the cervix, which is the sort of the opening to the uterus, the bottom. And so it really depends. So I would say if you're having bleeding after every time you have sex, you need an exam, because that can be a sign of something going on. Dryness, that can be something going on with the cervix. Now, every once in a while, we might have a patient who is sort of in perimenopause. So she hasn't gone without a period for a year and then restarted, but you're in that perimenopausal time, and there is some blood kind of hanging out in the uterus waiting to kind of be like a period, but
Hmm.
sometimes some spotting can result. So I wouldn't say ever that it can start menopause over, but it can cause some spotting. Something really important to take away from this answer is that if you're having bleeding more than just one time after sex, you should have an exam, because there can be something going on, something, like I said, on the vulva, in the vagina, on the cervix, or in the uterus. So anytime there's postmenopausal bleeding, generally speaking, so if you've been more than a year without your period and you bleed, whether it's due to sex or anything else, you need to have an exam with your OBGYN.
What exactly is vaginal atrophy?
So vaginal atrophy refers to what we were just talking about when the estrogen levels, because of menopause, start to decline. Atrophy means, like, I mean, it's sad to compare it to this, but like a raisin, when it loses its juice and kind of dries, that's atrophy, right? So it kind of wrinkles, it loses its elasticity, and it loses its natural lubrication. So atrophy refers to the same thing in the vagina, which is when that estrogen goes down, the tissue of the vagina thins, it becomes less elastic or less stretchy, and it stops creating its own mucus. And there's lots of things that can happen because of that. You can have the labia can kind of start to stick together. So I'm going to bring this back again. So this is what we call labial agglutination. So the labia can kind of stick together and become harder to kind of pull apart. The clitoris can also develop adhesion, so some scar tissue around the clitoris or between the clitoris and the clitoral hood. And then the other thing that can happen is that we can be more prone to micro tears or tiny little tears on the surface of the vagina and the vulva too. So that with penetrative sex, like if a penis goes in the vagina and it's not lubricated, it kind of drags, and that can cause little tiny tears. That can increase our risk for vaginal infection, and it can also increase our risk for urinary tract infection when the vagina doesn't have the that it needs, because it changes the balance, the pH, which we hear a lot about, the pH balance of the vagina. And that can kind of make the good bacteria die off and help the bad bacteria proliferate. And so it can increase our risk for urinary tract infections and vaginal infections as well. So vaginal atrophy, it has other names now: genitourinary symptoms of menopause, VVA, or vulvovaginal atrophy. These all are referring to the same thing, which is a complex of symptoms that are none of which are fun, caused by the lack of estrogen during and after menopause.
So my next question comes from our community, and this is a great one. Can sex help with my menopause symptoms? Can it help relieve my menopausal symptoms?
Sure. Yeah, that I love that question. And I think that it's interesting to think about. I want to preface with the fact that we don't have a large study to where I can speak from, but we do know that, generally speaking, not just for women in menopause, but people generally, that sex helps to release the feel-good neurotransmitters in our brain. And as we know, with menopause, sometimes it can increase our level of anxiety and agitation. So the release that we feel with sex, and particularly with orgasm, can help to combat that. Additionally, when we have sex, intimacy of any kind, plus an orgasm, prior to sleep, for many people that can induce a deeper and more restful sleep, which is another, bothersome symptom of menopause. So there could definitely be some benefit there. And another thing to think about after menopause is that when we are not sexually active, oftentimes we start to forget why we ever were in the first place. We're like, that's a lot of work, and that doesn't sound like any fun. And also the tissues of the vagina start to kind of act in the same way too. They might kind of start to retract or become a little bit smaller because of just lack of, use or exercise, if you will. And so whenever we stay sexually active, it helps us in our minds and in our bodies to remember why sex is a positive thing for us, hopefully in most circumstances. The challenge is if it becomes painful, then all of this wiring can be reversed. So we really have to be very on guard for painful sex, because if we have painful sex more than just a couple of times in a row, our brain starts to think, oh, this is
Mhm.
dangerous, we don't want to do this. And our body starts to think, oh, like, I'm going to protect myself, let me retract away. and not interact with that arousal pathway that my body's used to in the past. So there are definitely positive benefits to sex, throughout life, but particularly potentially during menopause. But we want to make sure to address any painful sex as early as possible so that we can keep those benefits going.
Well, and that can certainly lead to anxiety, which is, I'm sure, a
Mm,
big common theme and that women are
absolutely.
facing. Do you have any advice that you can give us and how to reduce anxiety?
The biggest thing about anxiety and sex is that we really have to, do as much as we can to try to get it out in the open. Because the more we try to kind of stuff it down or mask it with alcohol or, other things like that, the worse that it becomes. And so it just kind of festers, just like with anything in our life. So for me, what I've always found with patients is to come up with a game plan. So if you're having anxiety, it's very helpful to try to understand why. Is it because sex is painful? Is it because you don't desire sex anymore and you're kind of doing it as a favor to your partner? Is it because you're having body image issues that are new because of change in weight distribution,
Mhm.
because of menopause? There's so many reasons that we get wrapped up in our thoughts about sex during and after menopause. And so it's helpful to try to identify those and then to try to address each of those problems. So if it's painful sex, we need to see our OBGYN. That's just all there is to it. You need to just make sure that they know what's going on, that you know what's going on, and that you have a game plan in place. That could be lubrication, that could be moisturizers, that could be vaginal estrogen or other vaginal hormones. But if it's about body image, then sometimes we have to do real work about
Mhm.
finding other reasons that we love our body, maybe engaging in activities, not necessarily for weight loss, but to help us just feel better in our own skin, right? If there's something going on with your partner, menopause is not, just a time of transition for us, but often it is for our partners as well. And so maybe they're experiencing their own sexual dysfunction, like erectile dysfunction, for example, that can lead to a lot of other unsaid and unspoken anxieties and nervousness around partnered sex. So the more that we can lift these things up out of the darkness, have a conversation with either a physician or, on the Womaness blog or on the Rosy app, there's so many resources that we need to continue spreading the word about. And then we can really get women to these evidence-based ways to help them with these anxieties so they're not trying to struggle with it and deal with it on their own.
That's great. Well, thank you. And one last question. We have so many great followers here at the after party and within our community at Women sexual wellness being a big topic of conversation for us.
Yeah.
If there is one piece of advice that you could give them, what would it be?
I love that y'all have created this community because the piece of advice that I love to share is that you're not alone, right? And it's not just you. You're not broken. You're not doomed. Like all of the situations and feelings and experiences that you're having are common. And that's okay. And what that means is that, there's hope. There's hope for your experiences. There's hope for your future. There's hope for your relationships. And I think the more that we create conversations like this in communities like the after party, the more hopeful women can become that they will, in fact, connect with these resources that exist. And that's the thing, they're not hard to connect with. It's not necessarily difficult to find, the treatments that you need. It's just we have to be able to speak about them with each other, with our healthcare providers, and with our partners in order to get, in front of and connected to the things that will really help us.
Well, I want to thank you for your time today, and thank you so much for helping us break the taboo around this conversation. It is so important, like you said, that we have a sense of community, that we have a place that we can talk about it, and that we can have a little fun.
That's right. That's what it's all about. Well, I appreciate the opportunity. So glad to be here. So glad to talk about sexual health and sexual wellness. And just really admire all y'all are doing.
Well, thank you. Thank you, Dr. Harper.